Hello everyone, my name is Rimsha Jamil and I am student of B Farm, third year. I would like to discuss on the topic antineoplastic antibiotics. Antineoplastic drugs are the drugs which is used to treat the cancer, and for the cancer treatments which increases the risk of getting infection. So antibiotics are essential part of treating the cancer patient. Many cancer patients need antibiotics during all the stages of their treatment. Most cancer patients will need antibiotics to survive because at that time their immunity decreases. Introduction and definition. A real or true definition is a type of anti-cancer drug that blocks cell growth by interfering with DNA, the genetic material of the cell, also called antineoplastic antibiotics, or we can say anti-tumor antibiotic. Anti-tumor antibiotics are chemo treatment made from natural products produced by the species of the soil fungus Streptomyces. These drugs act during multiple phases of the cell cycle and are considered cell cycle specific. There are several types of anti-tumor antibiotics, which are anthracyclines, chromomycins, miscellaneous one, DOXORUBICIN and DAUNORUBICIN, epibrubicin, mycocentron, and idarubicin are the examples of anthracyclines, chromomycins, DACTINOMYCINs, and BLEOMYCINs. Miscellaneous one includes mitomycin and bleomycin. Now these are the some drugs of the antineoplastic antibiotics. DOXORUBICIN. Its brand name is Andromycin and the Rubex. Its formula is C27H29NO11HCl. It belongs to the class anthracyclines. Its mechanism occurs in the liver, and the routes of administration is intravenous. And there is no pill for the DOXORUBICIN. DOXORUBICIN first derived from the streptomycins, and DOXORUBICIN is one of the most widely used chemotherapeutic agent and generally prescribed in combination with other drugs. DOXORUBICIN has a broad spectrum of activity. It is sometimes called red devil chemo, partly due to its red color. It's one of the most effective drugs for solid tumor treatment. Example: breast cancer, small cell lung cancer, and ovarian carcinoma treatment. Now our next drug is DAUNORUBICIN. It's known by the brand name Cerubidine, formula C27H29NO10. It belongs to the class anthracyclines. Route of administration is the intravenous only, and it won't be given with the intramuscular or by the subcutaneous routes. Daunomycin was the first anthracycline compound to be characterized structurally and stereochemically. DAUNORUBICIN is used in treating acute lymphoblastic and myoplastic leukemias. Its contraindication is that it is not to be given to the pregnant woman, but the patient should not become pregnant while using this drug, as it may have harmful effect on the developing fetus. Common side effect includes bone marrow suppression, nausea, vomiting, hair loss, infection due to the bone marrow suppression, abdominal cramps, and diarrhea. Now, BLEOMYCIN. BLEOMYCIN is known by the brand name BLEOMYCIN, formula C55H84N17O21S3, class glycopeptide antibiotic. Mechanism is in hepatic, or we can say in the liver cells. Route of administration is bleomycin. For injection may be given by the intramuscular, intravenous, subcutaneous, or intrapleural routes. Bleomycin is also used to treat Hodgkin's lymphoma and non-Hodgkin's lymphoma in a combination with other medicine. It's also used to treat pleural effusions that are caused by cancerous tumors. Pleural effusion is a condition when fluid collects in the lungs. Mode of action is the inhibitor of DNA synthesis, with some evidence of lesser inhibition of RNA and protein synthesis. The next drug is actinomycin D, which we know famously known as actinomycin, known by the brand name Cosmigin, or we can say actinomycin, or we can say Acti. Formula is C62H86N12O16. It belongs to the class of polypeptide antibiotics. Administration is obviously intravenous. It is the first drug which was approved by the FDA in 1964 for the treatment of the cancer. It is chemotherapy medication used to treat the number of types of cancers. This includes Wilson tumor, ring sarcoma, trophoblastic neoplasm, rhabdomyosarcoma, testicular cancer, and certain type of ovarian cancer. It's given by injection into a vein. Dactinomycin is classified as a vesicant medication, meaning it can cause damage to tissue that comes direct contact with the drug. It needs to be given with extreme caution by qualified medical professional. You should notify medical person immediately if you have a pain or swelling at the infection site. Actinomycin D is shown to have the ability to inhibit transcription. Mechanism of action of the antineoplastic drug is anti-cancerous drug that affect DNA synthesis and replication by inserting into DNA or by donating electrons that result in the production of highly reactive oxygen compound, or we can say the superoxide, that causes breakage of DNA strands. These antibiotics are administered almost exclusively by intravenous infusion for the treatment of lymphoma and leukemia, nephroblastoma, sarcoma, and the cancer of testicles, breast, thyroid, the lungs, and the stomach. Antineoplastic antibiotics binds with the DNA, causing these famously coiled molecules to uncoil, thereby preventing RNA synthesis, a key step in protein synthesis. They also oxidize critical compounds the cell needs. This is the diagram of the mechanism of action. First, we can see here the DNA intercalation occurs where interface in the DNA replication and interface in the DNA mRNA replication causes this is the mechanism of action of this drug. Now second is the free radical generation, and third is the inhibitive topoisomerase. DOXORUBICIN and DAUNORUBICIN, they are having a mechanism of action. First step is intercalate between base pairs, inhibit topoisomerase 2, generate free radical. They block RNA and DNA synthesis and causes transscissoring. And for the bleomycin, oxidation of the bleomycin Fe3+ occurs, which reacts with the oxygen to form, and superoxide is formed, or we can say hydroxyl radical, which is depleted, which liberate electrons, attack the phosphodiester bond of the DNA, strand breakage, and chromosomal aberrations. Mechanism of action of dactinomycin is the same as the mechanism of action as the DOXORUBICIN and DAUNORUBICIN. Thank you. I hope you liked the video.